Morphine sulfate is a medication used to help relieve moderate to severe pain. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. It is important to follow the dosage prescribed by your doctor and take it at the recommended times for the best results. Before taking morphine sulfate, make sure to read the medication guide provided by your pharmacist. You can take this medication with or without food, and if you experience nausea, it may help to take it with food. If you are using the liquid form, be sure to measure the dose accurately using a special device, and do not increase your dose without consulting your doctor. This medication works best when taken at the first signs of pain, and if you have ongoing pain, your doctor may direct you to also take long-acting opioid medications. Suddenly stopping this medication may cause withdrawal, so it's important to lower your dose slowly under the guidance of your doctor. If you have a substance use disorder, take this medication exactly as prescribed to lower the risk of addiction. Be sure to inform your doctor if your pain does not get better or worsens. Side effects of morphine sulfate may include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, or sweating. These effects may improve over time, but if they persist or worsen, inform your doctor or pharmacist. To prevent constipation, it is recommended to consume dietary fiber, stay hydrated, and exercise. You may also need to use a laxative, so consult your pharmacist for the right type. To minimize the risk of dizziness and lightheadedness, stand up slowly when transitioning from sitting or lying down. It's important to remember that this medication has been prescribed because the benefits outweigh the potential side effects. However, contact your doctor if you experience any serious side effects such as interrupted breathing during sleep, changes in mood or mental state, severe stomach pain, difficulty urinating, or signs of adrenal gland issues. Seek immediate medical attention if you experience fainting, seizures, shallow breathing, severe drowsiness, or signs of a serious allergic reaction such as rash, swelling, or difficulty breathing. If you notice any other effects not listed here, consult your doctor or pharmacist for further guidance. When taking morphine sulfate, it's important to be aware of the potential risks and side effects. This medication has a risk for abuse and addiction, and can also cause severe breathing problems, which can be fatal. It's crucial to only take the smallest dose that effectively manages your pain, and to use it for the shortest possible time. It's important to ask your doctor or pharmacist about having naloxone available to treat opioid overdose. It's also important to educate your family or household members about the signs of an opioid overdose and how to treat it. The risk for severe breathing problems is higher when you start taking this medication, after a dose increase, or if you take the wrong dose or strength. Taking morphine with alcohol or other drugs that cause drowsiness or breathing problems can lead to serious side effects, including death. It's important to be aware of how to take morphine and which drugs to avoid taking with it. If you are prescribed the higher strength of morphine liquid, it should only be used if you have been regularly taking moderate to large amounts of an opioid pain medication. It's crucial not to confuse the dose in milligrams with the dose in milliliters. It's important to keep this medication in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, it's important to seek medical help immediately. For women of childbearing age, it's important to discuss the risks and benefits with your doctor before using this medication. It should be used only when clearly needed during pregnancy, as it may increase the risk of birth defects if used during the first 2 months of pregnancy. Using it for a long time or in high doses near the expected delivery date may harm the unborn baby. Additionally, babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's important to notify the doctor if you notice any symptoms in your newborn baby. Before taking morphine, it's important to let your doctor know if you have any allergies, especially to opioid pain medications like codeine. It's also important to discuss your medical history, including any brain, breathing, kidney, liver, or mental/mood disorders, as well as any history of substance use disorder or stomach/intestinal problems. Morphine may cause dizziness or drowsiness, so it's important to avoid alcohol, marijuana, and activities that require alertness until you know how this medication affects you. It's also important to inform your doctor about all the products you use before having surgery. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit/avoid sugar, aspartame, and/or alcohol, make sure to talk to your doctor or pharmacist before using liquid morphine products. For older adults, there may be a greater sensitivity to the side effects of morphine, such as confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, talk to your doctor about the risks and benefits of using morphine, as it may harm an unborn baby. If you are breastfeeding, consult your doctor before using morphine, as it can pass into breast milk and have undesirable effects on a nursing infant. It's important to be aware that morphine sulfate can interact with other medications, potentially changing how they work and increasing the risk of serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Remember, never start, stop, or change the dosage of any medicines without your doctor's approval. Certain pain medications, naltrexone, and samidorphan are some examples of products that may interact with morphine sulfate. Using this medication with other products that cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, can increase the risk of serious side effects. Additionally, it's important to check the labels on all your medicines, as some may contain ingredients that cause drowsiness. It's always best to ask your pharmacist about using these products safely while taking morphine sulfate. Lastly, keep in mind that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you use morphine sulfate to avoid any issues with test results. If someone has taken too much morphine sulfate and is experiencing severe symptoms like passing out or difficulty breathing, it's important to give them naloxone if available and then call 911. If the person is awake and not showing any symptoms, it's important to contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, a slow heartbeat, and possibly falling into a coma. It is important not to share this medication with others, as it is against the law. This medication has been prescribed specifically for your current condition, so do not use it for any other condition unless instructed by your doctor. In that case, a different medication may be necessary. If you are following a regular schedule for taking morphine sulfate and happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. As always, it's best to consult with your healthcare provider for any concerns or questions about your medication. When it comes to storing morphine sulfate, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. It's crucial not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. For more information on how to do this, you can read the medication guide that comes with the product, or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.